Well, good evening, everybody. I am a surgeon and a surgical program director, and I'm an ontologist, which means I try to teach computers how to understand human knowledge. I'm the founder of a company called Entrustable that aims to make clinical education better. In most models of personalized medicine, the doctor is always a uniform black box. But before collecting and dissecting more information about the patient, we should know more about the doctor. Because if you have the wrong doctor, you're not going to get very far. In healthcare, the electronic health record is all about the patient. Wouldn't it be nice if we had an electronic experience record controlled by doctors? Because we know that doctors get better at understanding and solving problems that they see more often. All of these people are board certified in my field. Which one of them would you see for your broken cheek fracture after you fall off of your bicycle? We face the same problem in education. Experience is the hardest quality to find, but it's the most valuable resource in healthcare. In education, we don't know, we have trouble with the opposite side of the coin. I don't know what my learners have done. I don't know what experiences they haven't had. I don't know who's struggling amongst my hundreds of students. So if we're going to have this patient-centered healthcare, then patients actually have to have more knowledge about selecting their doctor than they do about choosing a rental car. And that has to start with education. It's not going to start with a 60-year-old. Training to be a doctor is a lot like training to be an elite athlete. But elite athletes have a lot of data about their performance, and they use that data to get better all the time. Clinical learners don't have any of that. We just show up to work every day. And this is what we have. We document our experiences, and we need to make this better by using modern technology so we can use the same kind of benefits that elite athletes get. The core problem with all of these issues is that although we're humped over the computer all day long entering data, the computer doesn't understand what we're saying. It doesn't understand the context. This is really tragic. When I say that I did an open treatment of an orbital 4 fracture, CPT code 21846, the computer doesn't understand that I operated on a bone that's part of the face, and that I inserted an implant that affects the visual system. This means that computers can only store and retrieve data for us. And they should help us analyze our information. To solve this, we need to give the computers knowledge, like knowledge that I have. Knowledge and understanding of the world, and we do this through a form of artificial intelligence called a knowledge graph. Knowledge graphs are super cool because they don't care what they work on. They can build all kinds of applications to help solve problems in healthcare. And we can chew on this big raw set of data, big data that we have to find useful nuggets of actionable information that can actually change behavior. We've used it in our company, Entrustable, to build an app that allows learners to record their experiences in terms that both the learner and the computer can understand. So the computer can give you rich feedback about your performance over time and how you compare to others. This is what a knowledge graph looks like. It's a way of describing the world to a computer. It consists of concepts in the world and how they're related. So if I want to describe that a learner treated a facial injury, it can hop the relationship in the graph and do that. Graphs are extensible, so the format we've built can be extended to other healthcare domains. And other people can add their knowledge. We can let students leave school with rich portfolios of information that understands the differences in their different curricula and helps us track their accomplishments, their entrustability, their competency, which levels of autonomy they should have. We can use them to generate on-the-fly reports about individual students for professors who don't know them very well, and try to get and receive feedback and know that that feedback is tied to what that certain learner was doing when they got that feedback. Right now we have the AI and a working app prototype in my program. We're going to build a production app in dental education and then move forward to other healthcare domains. And then other use cases like billing and credentialing, where the intelligence would also be very helpful. So in summary, computers can't help us if they don't understand us. Experience is a valuable resource, but we need the help of AI to find it. We want to match problem havers with solution knowers, and education is the place to start. This is our small team at Entrustable, and thanks for your attention.